And welcome everybody. Thanks for taking the time to be here today. I'm, as Alex said, Kim McGrail, and I'm just going to give you a few opening comments just to set the stage for trusted, secure environments, with the bulk of the time, of course, being given over to our panel presenters. So if we can go to the next slide, please. So I'm just going to use BC, British Columbia, as an example of the sort of developmental pathway for trusted environments, which are now a pretty accepted, and I would say in many cases expected piece of the infrastructure for health research in particular, lots of research in general. So starting in BC, if you can just click next slide. In 1996, it was when British Columbia proclaimed the Freedom of Information and Protection of Privacy Act, which is really what allows data linkage, use of administrative data and other kinds of data for publicly collected data for research, and also helps set the standard of expectations around that. So based on that, if you can do next slide, please. Based on that, it was Population Data BC's precursor, but what happened was a group of people got together and developed a research data framework that would comply with this new piece of legislation, because it had a research framework for what was expected for research using linked data to be done. And we started operating a system where we were giving out linked data to researchers. And at that time, this is 1996, so we actually burned data onto CD-ROMs and gave it out to researchers that way. And I'm sure there's people on this call who are probably not even born at that time, so CD-ROMs is going to seem archaic, but this was the way that it was done. And what we realized in speaking over time with our data providers is that this was acceptable and it was standard in the 1990s, and we had controls over that. We had people attest to the fact that at the end of their project they destroyed the data and they didn't keep the data around, but it really felt to data providers that there was something missing from that it really was a situation that we could provide more protection if they could keep a certain amount of custody and control and oversight over how the data were used. And so that led us in 2010 to open up the secure research environment, which has many of the same properties as the one we operate today. I think go to the next slide, please. So the idea here of the secure environment is we can put data in a safe space that's governed commonly. You can have virtual access to those data, but you no longer as a researcher can actually hold the data. And it means, for example, that when an ethics allowance expires, the data could be turned off, or when you reach the end of your agreed timeline for access to the data can be turned off, and we can control the outputs and so on. And so if you think forward then to the evolving ideas of the 5 safes, the safe people, safe projects, safe settings, safe data, and safe outputs, this is the safe settings part of that. This is kind of evolved to be, as I said, the expected environments that people are working in. So it's a way to protect data, but also to enable researchers to use those data, and secure environments give us a way to help evolve the way that we do things as expectations, as opportunities, as new threats and new possibilities evolve. These safe environments can evolve as well. Next slide, please. And the other piece of this, of course, now is the evolving expectations and desires around artificial intelligence. So I think trusted environments are going to continue to have to evolve. We think about different compute needs for artificial intelligence. We think about the different data that are desired and different ways of bringing them together. So with all that said, this is why we felt that in thinking about federated analysis, that the discussion of the secure environments becomes really, really important, because they're such an essential ingredient to all of that. And with that, I'm going to hand it over to our first speaker, which is Charles.
Hi, everybody. A pleasure to be here today. So I'm going to talk a little bit about the secure research environment that we have in Ontario, ICES. So we were founded over 30 years ago, and as an independent not-for-profit research institute. So we don't have a formal tie to university or a university hospital, for example. But what we have is a unique situation where we have incredible authorities under our privacy legislation in Ontario to be able to collect and link together health and healthcare data for the purposes of evaluating the healthcare system. And we recently, our authorities under another piece of legislation have been expanded such that we can collect non-health data as well. Similar to what Kim described prior to the 2010s, next slide, the secure research environment was effectively bricks and mortar. It was, an institute that researchers or their students would have to physically locate themselves in order to be able to access the data. So the solution to be able to provide broader access across Ontario was to increase the number of sites or nodes. And we developed brick and mortar sites at each of the major medical schools in Ontario. And this allowed broader access to these data. Next slide, please. Just a quick note about the types of data that we hold in our repository. So we maintain a core data repository of over 110 data assets, which comprise thousands of data tables, which include information on people, their vital status, some information on their immigration status, for example. And then the mainstay of our data is the health services. So physician claims, discharges from hospitals, long-term care, et cetera. We have data on the health services and the providers and the facilities. And we have a number of registries as well. So our cancer registry is within our repository, as well as specific disease registries like diabetes, inflammatory bowel disease, asthma, et cetera. And increasingly, we're incorporating intersectoral data. This is data such as social assistance data, education data, environmental data, and this will be increasing with our new authority over the coming year. And then finally, we can bring in data that is specific to a research project that a researcher might have collected. This could be trial data or survey data, and we can bring that data in and link it. So we can create quite a robust history of the individuals in a particular cohort and their healthcare use in Ontario. Next slide. So in terms of our timeline and development of our remote secure research environment, as I said, prior to 2014, all access to the data was on-premise, and all access was only for ICS affiliates. So we had requirements that you had to become an ICS agent. That could be a student that went through particular training, or it could be an ICS scientist. So these are faculty members at universities that apply for an affiliation to ICS. In 2014, we developed our remote access research environment through our data and analytics services group. And at the time, this was called IDAVE, which was essentially a virtual environment, which gave third-party researchers, so non-ICS affiliates, access to data that had been risk-reduced and coded. So we would obscure or mask dates in the data, but researchers could receive access to line-level data. Since 2014, we've expanded the types and number of services available through this remote environment considerably, including allowing access to services for privately funded researchers. And in 2021, providing access to our data safe haven, which is so remote access to a high performance computing environment to support machine learning and AI research. And there's been lots of learnings from that process. As Kim alluded to, some of the types of tools, softwares, and technologies that these new analytic methods require make it challenging for secure remote research environments, and we could talk about that in the panel discussion. Thinking about the future, where we're headed, a number of things. Number one is to increase access for data for the purposes of federated data analysis, and that's in part our work with HDRN is to look at technologies that will enable federated data analysis, as well as providing access to data and services for communities, be it advocacy groups, be it specific communities like Indigenous communities or First Nations communities, and then as well greater availability of the social and environmental determinants of health data under our new authority. So that's a quick snapshot of our environment and our pathway, and I think we're on to Maureen, I think.
Yes, thanks. So hopefully, as many of you may know, CIHI is a pan-Canadian organization. We get data from across the country in about 27 different databases. We have, although we don't do research ourselves, we make data available to researchers. So we have a lot of stakeholders from the health system. We produce a lot of data publicly available. And then we also have a service, if none of those other tools and what methods of getting data in, we've always had a kind of third-party ad hoc data service, which has primarily been researchers who have wanted access to specific cuts of data to help meet their research needs. So as Kim mentioned, kind of the driver for our research secure access environment was really through our board, and in particular our BC representative on our privacy subcommittee for our board, to really drive better secure access for data for researchers, so that we didn't have to send data out, because we did also used to send data out on CD-ROM. We did have and still do have a virtual way of doing those things electronically where we need to, but this was a really kind of a way for us to move forward with much more secure access to the data and the most sensitive data that we're giving record level access to researchers for this data. So if you could go to the next slide. So our journey started a little later than POP-BC and ICES. So we had a pilot in 2021 to kind of set up an environment, and at the time CIHI is was a very SaaS-based organization. So we went with the software that we had available to make it available in the SAE, which was SaaS. And then after that pilot, very successful pilot, we launched operationally in 2022 with some additional new projects, and kind of we also implemented different software, so R and Python, and really kind of, and I'll touch on some of the learnings we had as we went through the development process. At this time as well, when we started the project, we were still on premises. All of our servers and everything were on premises, and in the middle of this, we moved to the cloud as an organization. So that also meant that we moved our SAE environment to our kind of hosted cloud provider. So over the last couple of years, we've been building up the capacity in the SAE, evaluating kind of how it's working as a service, both technically and from the team responsible for supporting the researchers using the tools. And we're now kind of looking at kind of where we're going and moving forward with growth and expansion of the environment. So looking at different tools. As I said, the access right now is very much focused on providing the ad hoc data that each individual researcher needs for a particular research project. So looking at how we can change and improve the processes and the timeliness to get that data into the environment for the researchers. And being able to support all of the requests that we get for data. So if you go to the next slide, I think some of the things that we've done and thought about as we've developed the research environment is needing the technical capacity to grow with the usage. And so, for example, when we first set up our SAE, it is not currently set up with some of the processing power that, for example, the ICES environment currently has for high performance computing and big data analytics. We also know we've got ways where we can enhance the service in terms of meeting the demand for data, as well as the technical and data support that users need and the researchers need as they're using the environment. And also the kind of output vetting. So we obviously have a process where we have to check the outputs before any researcher can remove them from the environment. So that's additional work and effort that we have to take on at our side. So how we can standardize and improve that. As we know, researchers have got lots of different diverse needs in terms of tool sets that they are used to using in their own environment. So how can we support those? We've added some, but I know there are others that we're looking to do, and we're actually transitioning away from SAS as an organization. So we won't have a license for SAS in the future. So we have to transition our existing users, if they're using SAS, onto something else. And looking at the pricing model that we use, obviously because we're on the cloud, we've got a lot of ability to kind of monitor usage and the patterns of usage, and looking at the costs and how we can offer some more flexibility in the way in which we do the costing and approaches to that. So if you just flip to the next slide, I think I've touched on most of these, but we have quite a few grand plans moving forward to address most of these issues in the next few years, and continuing to learn from all of the other folks who have got environments across the country, really looking at kind of what do we need to do to enhance the actual technical infrastructure of our environment, add those tools that are going to add the most value to the researchers actually using the environment. Thinking about how we expand the scope. So for example, right now, the way our privacy policy and our PIA was set up originally, it was only for de-identified data. We are in the process of being able to expand that to include PHI releases that we're allowed to do under specific circumstances for research. And look at how we increase the support for the users as we grow the environment, but also ways in which we can add process improvement to be more efficient and effective as we go. So that's a quick summary of where we're at with our research environment. So next, I will pass you over to Ted.
Yeah, hi everybody. So I'm going to give you a very quick tour of the New Brunswick Institute for Research Data and Training, which is our provincial research data center in New Brunswick. And as you'll see, as I go through this, that there are a lot of similarities between our data centers. So some of the things that ICES has been talking about and CIHI have been talking about, we are doing similar things. But you'll also, I think, see that that there are significant differences, because each of us set up without a national coordinated strategy for how to do this as a single entity. We all develop these things within our jurisdictions. And so I think this sets us up for the subsequent discussion when we talk about things like why is this so hard to do? So I'll give you a tour of NB-IRDT, and then hopefully you'll see both the similarities and differences. Next slide. So this is our current state, and where we are well advanced in terms of the national landscape is in terms of our data holdings. So these are all, and the usage for the term de-identified, pseudo-anonymized, anonymized, it varies from jurisdiction to jurisdiction. But the data sets that we have are prepared versions where direct identifiers, names, addresses, social or Medicare numbers, have been stripped out and replaced by a unique identifier. What that means from a research perspective, like most of our partner sites, is that researchers can get access to linkable person-level data from across the series of data sets. So we've got more than 100 data sets here. We've got 53 person-level health data sets. Where we have a real advantage, I think, relatively speaking, is in terms of our health-adjacent data sets. So we've got 39 different data sets under the social umbrella. That includes report cards and attendance scores and behavioral scores for kids. It includes post-secondary scores, programs, graduation, community colleges. We're working with private sector colleges and universities in New Brunswick to get data there, income support, home care, and so on. External data sets, similar to what Charles said, we have the capacity to receive data from anywhere in the province and then link it to the administrative data sets. More recently, we've been working with the Department of Environment and Local Government with and we're getting a lot of environmental data sets. This includes everything from industrial accidents and exposures to air quality, water quality, to E. coli outbreaks on beaches, well water quality. And so those are linkable also at kind of the small geographic area. That's where we are now. But I want to emphasize that although we've made a lot of progress in terms of the data that we have, our current state is what ICES was back in 2014, that we are an air-gapped network, which means you have to be on site in one of our 3 facilities in Moncton, Fredericton, or St. John. You have to be on site. And that is a limiting factor. And I'll get to that, what our next steps are, what our future state is in just a minute. So very quick, Ed, probabilistic linkage. So the Department of Health actually does they provide the corporate services doing the linkages for us. If any data set has a Medicare number, a provincial insurance number, which covers almost everyone in the province, then the linkage is direct. If it's not, so if we've got education data or training data, then it's a probabilistic, and I can get you more details on the methods that the province uses to do that for us. Next slide. So where we sort of behind in the rest of the pack in terms of the ease of getting access to data, we actually have made great strides over our short period of time. We just had our 10-year anniversary from the initiation of it. And I'll point out a couple of things. So we've got in the orange line the number of projects, the blue line the number of data sets. And you can see that for the first few years, it was very small. And this was because, in terms of scope, this was because of a number of restrictive legal interpretations. But in 2017, and more importantly in 2019, and you can see this as an inflection point in the graph, we had something called the Act Respecting Research passed. So this was enabling research that allowed NB-IRDT to receive data from anywhere in the province, as long as it's from a public body or not-for-profit. We are also working on doing that with data from commercial entities. But you can see that in 2019, with this authority to receive data under this Research Act, the number of data sets we started to accumulate really took off, and the projects increased similarly. All projects have the standard kind of checks: ethics review, privacy review, government review, and results are embargoed. So all of this activity with the projects, this is required people to be on site, and that's one of our limiting factors. Next slide. So here's our future state, and I deliberately did not simplify this because I want to really reiterate how complex a lot of this actually is under the surface. So what I've taken here is an excerpt from our prospective PIA, Privacy Impact Assessment. What we want is that we want to have, not only do we want to have remote access, but we want to have a hybrid environment. So we've got on-prem servers where our data currently sit, but we are linked to a cloud. This is a cloud external to UNB. It may be a commercial cloud. It could be part of the DRAC, the Digital Research Alliance of Canada network through AceNet. Could be other options. We're working with AceNet now, where from the user's perspective, it's a seamless kind of entry that you can either access data on-prem, remote through, or access remotely, but on-prem services depending on the use, or in the cloud. And this should enable us to do applications with AI where you need high performance computing, which we just don't have on site. And all these different colored arrows flowing back and forth, we have to map out every data flow that comes to us from a data provider, that comes from us to a user based on the different use cases. So while the concept of a hybrid environment is straightforward, under the surface, when you lift the hood, the complexity of mapping out data flows in terms of the mechanics of data flows, the privacy implications of data flows, the technical security is pretty complex. But this is our future state. And so we're actively working on this now. We hope to have a working model that actually that demonstrates that this, even though it's complex to be laid out, it's from a user's perspective, it's really seamless. So I'll stop there and hand it back to Kim to moderate the next part of the Q&A.
Great.
Yes. So quick. Oh, sorry, Matt Russell. Just a very quick question. Yes, you can, as long as you're in Canada, you'll be able to access New Brunswick data from anywhere in Canada. Thanks, Harry. Sorry, Kim.
Yeah, no, that's great, and it's see that there's been a little bit of exchange in the chat so far. I encourage people to put questions there, to raise your hands, and we will answer them. I'm just going to pose an initial question, say thank you to all the speakers, and it's kind of like the past, present, and future. You've covered that very nicely in short form. The question I want to pose to get things going in this part of things is, what do you see as the biggest challenge? Ted started mapping some of that out, but I wonder if there's other things that you want to add, or Maureen and Charles, if you want to add to that. And what do you see as the biggest opportunity in the secure environment space? So whoever wants to go first on that.
Well, I'll start off. I think the challenges, why is this so hard, are pretty well known. They've been documented in numerous reports from Council of Canadian Academies and other groups. And, you know, just to list them very quickly, we have an incredibly fragmented data landscape in Canada between the FTPs, the feds, the provincial government, the territorial governments, within provinces, between departments. There are barriers to sharing data between departments and agencies, and within departments and agencies, there are barriers to sharing data. So it's an incredibly fragmented picture. We have challenges with distinct overlapping legislation, variations in interpretation of legislation, no common identifier, no common data definitions, no metadata, consistent metadata, data standards, and a wide spectrum of hardware and software. We are, in most cases, receiving data secondarily, so we're kind of beholden to the systems that are in place, and many of those are legacy systems. And so one of the benefits of, and where HDRN comes in, is that at the provincial level, our provincial data centers have solved a lot of these problems. We have figured it out at the provincial level. We've negotiated and navigated our way so that data access at the provincial level is pretty straightforward. But that is within the province. So how do we then solve the problem of connecting all of the work and data sets that we have in the provinces for multi-jurisdictional research? That's the challenge, and that's what leads us into these discussions about federated analysis, because I think at this point, it's fair to say it's still way too hard to move data across provinces, and I don't think we even need to do that, and we'll get into that later. So that's my sort of first pass at that question.
Do you want to go, Maureen? Or?
Yeah, I was just going to say, I agree with absolutely everything Ted said there. And I think also, like, mentioning some of the technical challenges, these are very complex systems. We're providing very detailed access to researchers to very sensitive data. So the privacy and security aspects of maintaining that and managing that risk is kind of part of the complexity as well. And I think the the business functions that we do, although very similar, are actually slightly different. So for example, you know, the different, being in a research institute, CIHI is not a research institute. So we are providing this really only for third parties who can't, and we have our own internal analytical environment to do our own analytical work. So that has some complexities and other organizations, because they're set up for different with different mandates, I think also kind of have those different complexities. And we're all doing things right now independently. So we haven't really been able to kind of, and we're starting to share information and share knowledge about how we've done things and how we've set things up, both from a business process perspective and a technical perspective. And being able to learn from each other as we're learning and doing these things. So yeah, pass it on to Charles.
Yeah, so I agree. So I won't reiterate those. I'll just add another challenge that often doesn't get seen by the researchers, and that's our compliance regime. You know, research is expensive, or access to these data can be expensive, and sometimes researchers don't, I think, appreciate why. One of the challenges is we're very highly regulated. We're regulated by the Information and Privacy Commissioner of Ontario. We have to be reviewed every 3 years, but it takes a year, sometimes a year and a half, to produce the report that they're going to review. So we're actually constantly having to keep metrics on which data are used, how they're used, what are the purposes, and sort of that compliance end of things really adds a huge back end to the organization that is really, you know, people responding to data providers, responding to the Information Privacy Commissioner. And so for me, that also represents an opportunity, is how can we better use technology to simplify or automate some of that compliance. But really, the biggest opportunity is, I think the purpose of this series is federated data analysis. It's a lot easier if data does not have to be physically shared, or you know, if data visitation models are employed, and increasingly the technical tools are out there. I think to be able to provide a greater experience for researchers conducting federated data analysis.
Great, thank you for all of that. There is a question in here about have you had more success with sharing or getting metadata, and just understanding that metadata is a pretty important precursor to being able to use these secure environments in a federated sort of system. Metadata is often messy or incomplete, sometimes not possible to share. So any comments from any of you of how you're dealing with that and what the opportunities might be?
I'm be happy to start it. You know, I think Ted alluded to this a bit in his talk, that, you know, to some extent we're beholden to our data providers. You know, we're data aggregators. And when it comes to things like the health administrative data, you know, your physician claims, there often isn't very good metadata, and it's very difficult to get metadata. So it falls to us to create that metadata for researchers. And I think that it's particularly challenging, you know, as we started engaging more with researchers interested in doing machine learning and artificial intelligence. You know, they would say to us, "What does this mean?" And there would be times where, "Well, we think it means this." And, "Well, where's the metadata? And why aren't you releasing the metadata?" And it's difficult sometimes for them to understand that that data just doesn't exist.
Yeah, and I'll add, just to build on what Charles was saying, that sometimes our development of metadata is almost like requires forensic analysis. We are trying to figure out what we got from providers, where the underlying systems from which we're getting data have no consistent way to define and record data standards and metadata. And this is just a function of a lot of these legacy systems were set up to do very specific purposes, to report on hospital bed capacity. And the awareness and recognition that there's a lot of value to unlocking these data, the systems underlying them haven't caught up. So when researchers want metadata, and we need metadata to be able to do this kind of multi-jurisdictional research, we often have to try and figure it out from a small number of pieces going back. And sometimes if it's historical data, anyone who was there who'd helped design the system within the provincial government is gone. And so it's just because, if we were going to, no one would design a system like this to begin with. And I think things are improving as different hospital systems and provincial governments are overhauling their system. They're building this in, but we're playing catch up here.
I would agree. And I think even kind of looking at CIHI, and we've probably got some good documentation, but it's still very different for the different systems, again, because the systems were built in silos, and where we often are reliant on those other systems as well. And sometimes it's very focused just on, you get the technical information about, the data layout and the data format, but not the information that you really need to be able to understand and use the data responsibly in terms of issues, data quality, those types of things. Those are often lacking, so that making the interpretation of the data sometimes difficult.
Yeah, and I would just point people to our learning series on big ideas about health data that points to a lot of the things that Maureen was just thinking about, the kind of things that we haven't traditionally thought of as being important for analysis within quantitative data spaces, and understanding the biography of data and that sort of thing. So there's resources available for that. I wanted to ask you a question now that has to do with this sort of input to an output from any kind of federated analysis we might be able to support. So obviously input to, or a necessary precondition, is having harmonized data sets. And once you have harmonized data, then there's the output of the analytic code you use, the process you use, the kinds of assumptions that you made. So where are we in thinking about how we can share that kind of information with GitHubs as one way to do it? We've talked about national concept dictionaries and that sort of thing. So where, on either end of that, where do you think the most important next steps will be?
Yeah, I mean, I think we're very early on in that journey, and I do think critical to that is, as we've discussed as part of Health Data Research Network Canada, the development of the National Concept Dictionary that will be, publicly available to researchers and researchers that want to use our units. To me, that's critical, because when I see research projects that are trying to perform federated data analysis, researchers work within silos, and so they're going to be recreating the wheel many different times. 3 different research projects will redefine a concept 3 different ways and spend time looking at that, as opposed to having that centralized source. So I think that is really, in my view, a key role that Health Data Research Network Canada can play, is providing those tools for researchers across Canada.
I'd take a step back even more fundamentally, because there are many researchers and lots of people in this conversation who are familiar with federated analysis, and they're asking technical questions. But a lot of the time, for a lot of researchers, the more fundamental question is, why can't I just have the data? Why can't you just give me pooled data? And so I think part of what we have to do with HDRN is really start at the point with the researcher. What do you really need to be able to answer your question? You don't necessarily need pooled data from multiple jurisdictions. That a federated data analysis approach, as long as it's workable and scalable and reasonable cost can get you effectively what you need to do to answer your questions. So I think even at the more fundamental level, it's raising awareness about the strength that a federated analysis has to deliver these kinds of the kind of data infrastructure that we need to answer these questions. But we have to get beyond well, why can't you just give me the data? Because although there are many things in our control, as Charles alluded to, we are very restricted in what we're allowed to do. And so because of those restrictions, we can't just send people data. So this is kind of like the next best thing. There's a ton of work that we need to do to get into that structure. But I think also we kind of have to win the hearts and minds to say, this is good, and this will help you answer the questions that you have.
And I think to add to that, I think just going back to the metadata question, having the understanding when you're doing federated analysis, where the similarities and differences may exist across the different jurisdictions with the data. Some of that may be because you've got different coverage, you've got different data sets and availability. So what you can link, what you can't link is going to be different. But also, even when you have the same data set or similar data sets, there may be some differences in terms of how they were implemented in the different jurisdictions, and those will impact analysis. So going back to that, having that good consistent documentation across the different types of data that we have and across the different jurisdictions would be, I think, really invaluable for the researchers.
Great, thank you for all of that. I mean, part of the reason that we put this secure and trusted environment session into this collective learning series is because they're fundamental and a really critical ingredient to this, but also in part because finally these environments have gotten quite a lot of attention, and particularly in thinking about being able to work across trusted environments. You think about some of for those who've seen it, the DARE program in the UK, the Global Alliance for Genomics and Health has been thinking about these kinds of things. So the question for you is, what do you see as a good next step, a way to bring trusted environment practice together? Or like what would you recommend or like to see as somebody who's in the middle either of operating or developing something in this area that would help the next person to come along or help us get to the place where we're supporting researchers in the more holistic and fulsome way that you've been describing?
Well, I'll go first, just speaking from a relatively newer data center where there is no guideline. There's no guidebook for how to do this within a province. And a lot of what we're doing is making things up, inventing, coming up with ideas, running them by our provincial partners. They do not give us much guidance. They just say whether they're going to like it or not. So for us, being part of a network like HDRN, where other jurisdictions have done a lot of work already in terms of metadata standards and setting things up in terms of technical and infrastructure and data flow to facilitate this, for those of us who are sort of more greenfield sites, so Saskatchewan is one of those, PEI is one of those, that we can sort of leapfrog the difficult kind of ad hoc kind of solutions and try and build in, as we develop our system, something that is already consistent. So it's our opportunity to kind of have a say in how things are moving forward because we're relatively new. And so we lean a lot on our provincial partners, not just in terms of how they're doing things, but in terms of their expertise. Smaller jurisdictions, we just don't have the capacity, even if we were so inclined, to be able to do this. So the idea of developing these things and spreading them to all our sites, we're sort of automatically building into our own processes the facility to be part of this kind of distributed analytics with consistent documentation, metadata, data standards, and data flows.
Charles or Maureen, you want to add anything?
Yeah, I would say, to Ted's point, that there is no sort of structured, collaborative space for this, but there should be. And I know in Ontario, It's a coalition of the willing. And, while we have HDRN Canada, which, are all sort of like organizations, there isn't necessarily the connection with the organizations that are doing genomic work and have trusted research environments for genome data. In Ontario, we're trying to develop a little bit of a coalition of the willing with other institutes like the Ontario Institute for Cancer Research, OICR, which does some genomic work, so that we can share best practices. But I guess one of the questions is, whose remit is it to sort of ensure that the various TREs and SREs are working together? And that's a good question.
Yeah, because I think as well as all of the kind of provincial ones, I know, individual institutions or networks of institutions are setting up their own for their own purposes as well. And I know we've definitely benefited, and again, on a very ad hoc basis from kind of learning from ICES and Statistics Canada, who has their own, they've set up their own virtual data lab as well. And other people and PopBC, like in terms of how we've done things and learned. And I would agree, having that sharing information, because again, everybody's internal technical teams this may not be their area of expertise, but collectively we've probably got a lot. And I think for me too is just like, what are the standards that we need to be thinking about setting for these environments, so that we can feel we can trust each other's environments as well, so that if we do need to share, because there's still going to be instances, for example, if we get a consent-based research request where a researcher is wanting to link their research data with CIHI data, unlike ICES, we're not allowed to bring that into our environment, so we need to send that to their environment. How can we make that easier so that we can trust each other's environments, as well as the researchers who come in to access our environments, kind of from an organizational perspective? So that's one thing I'd love to see in the future too.
Great responses. I mean, I think if I were to summarize it, so I'm going to summarize a little bit and then give each of you an opportunity to say one last, or to give some parting comments. So I think what we're hearing is that there are currently lots of variation in practice across trusted environments, and that's partly because these things have developed at different points in time, but also reflects the fact that there's a constant evolution in thinking about privacy, cybersecurity, researcher ambitions. Like, all of those things are playing into the fact that this is not going to sit still, this space. Like, we can have trusted environments, but the particularities around them, the guidance we might give to the next one setting up, is likely still to evolve over time. And I think that's part of the issue here is, as Maureen just said, we could have some standards or a guidebook, as Ted suggested. We could outline current practices, but we are also going to then need to modify those practices as the world changes around us. So the idea of creating a community practice or sharing is probably a really good one. We'd have to think just carefully about how to do that, because it is this constant evolution. So with all of that, great discussion, I will just leave it to each of you to give some parting comments, and maybe we'll go in the order of presentation. So I'll start with Charles.
Sure. So I think it's, this series has been an excellent series. I've taken part in a number of the sessions, and I think this is the future. But I think, to bring those folks along, researchers along, that, everyone, I'm a researcher as well, and data analyst, and yes, it's easier to work with pooled data, and I love it when I can get all the data together, but there's a lot that can be done with this. So I look forward to getting pilot projects done, getting some examples of research that has employed federated data analysis. And I think that's really the way to move forward and bring our research environments together in a way that's compliant with our provincial legislation.
Great,
Yeah,
thanks.
and to add to that, I would say, I'm always conscious of that these environments, and sometimes we focus on the technical environment, all of the technical issues, is really the service in making sure that we're providing the services that the researchers need to actually use and analyze the data and be able to do their research easily and efficiently. So I think that's always something that is top of mind for me as well, in terms of some of the supporting services that we need to provide, as well as the technical environments to make this work.
Much of the focus in thinking about federated analysis has been horizontal connection. So similar data on different people in different provinces. And we've talked a lot about the complexities of being able to do that efficiently and at scale. But I think just as big a challenge, or perhaps a more complicated one, and something that HDRN is working on with Statistics Canada, is the idea of vertical federated analysis, where you've got different data sets, but on the same people. We know in our provincial data centers, we have big gaps. No one has income tax data. There's very little in the way of personal information on individuals that might come from the census. So how do we figure out, while we're looking at kind of this horizontal integration, how do we also figure out vertical integration so that we can fill in some of those gaps and really understand what a person's journey is through the health system, factoring in all the socioeconomic and interaction and environmental determinants that we can't get in other places. So for me, that's part of what we need to be working on. We are working on it, but it's not just horizontal federated analysis, it's vertical as well.
Great comments from everybody. Thank you so much.